Okay, hello everybody. This is the second video lecture I'm going to put together here for you. I'm day 8 million of social distancing, also day 3 of no shave here for Mr. Grable. We'll see how this comes in, how long I can stand it, and how long my wife lets me grow it for here. So today's topic: blood vessels and blood pressure. So these are just a couple of things that I want to run through with you. Hopefully you know that the different blood vessels in the body, the main ones are arteries and veins. We kind of talked about that in the previous video. But what you should know is that the arteries are the main blood vessels carrying blood away from the heart, and as they move away from the heart, they branch out into smaller vessels called arterioles, which eventually branch into tiny little blood vessels that are one cell in diameter called capillaries, which is where all the work actually occurs within the circulatory system. That is where oxygen is exchanged with carbon dioxide in our body tissues, and also where nutrients are exchanged for waste at our body tissues. Then those capillaries join back together into smaller blood vessels called venules that are starting to bring blood back towards the heart, and those venules all merge into even larger blood vessels called veins that finish off the job of returning blood back to the heart. So if we take a look at cross sections through arteries and veins, you can see over here, this is a cross section through an artery. Here is a cross section through a vein. And we get these little branches coming off of the arteries called arterioles that branch further into capillaries that you see here. These are one cell in diameter. And this is where gas exchange takes place. Like I was saying, these join back together into venules, which all drain into much larger veins. A couple of things to notice here as we look at these blood vessels. If we take a look at the artery over here first, you're going to see that the outer layer is thicker. This outer layer is called the tunica externa, that is connective tissue layer. This middle layer here that's called the tunica media is much thicker in an artery than it is in a vein. This tunica media is made of smooth muscle that will constrict or relax depending on the body's needs at the time. In terms of body temperature, blood pressure, etc. And then lining the innermost layer of both arteries and veins here is the innermost layer called the tunica interna, which is a single layer of cells called the endothelium. It's very smooth and allows blood to flow through here with very little friction within the lumen of these blood vessels. And if you look, you should be able to see a big difference between the lumen of an artery versus the lumen of a vein. Right? The vein is much larger over here. And veins also have valves within the lumen of their blood vessels, whereas arteries do not. Blood in arteries is under much higher pressure than it is in your veins, because this is much closer to the heart in terms of the flow of blood from the heart to the body. Blood in valves is under much lower pressure, so it has a tendency to, between contractions of the heart, it has a tendency to actually kind of drop back down due to gravity, and so these valves prevent that blood from pooling down at the bottom of your legs, for example. Okay. So this slide here just goes through those 3 layers for you that I just highlighted. The tunica interna, which is made up of the endothelium, that single layer of cells. The tunica media, the middle layer of our blood vessels, is that smooth muscle layer, and the contraction or the relaxation of that smooth muscle is controlled by our sympathetic division of our peripheral nervous system. And then the tunica externa is mostly fibrous connective tissue, that layer that wraps the blood vessels on the outside. Okay, so a couple other things that I pointed out to you. The walls of your arteries are much thicker. The lumen of your veins is bigger. One of the key factors to get blood moving through your veins is actually the skeletal muscle milks or squeezes your veins and pushes that blood up towards your heart. And so we'll see a picture of that on the next slide. And then the walls of your capillaries are only one cell layer thick, which allows for the exchange of gases and nutrients and waste between your blood and the tissues that it is feeding. So this picture here shows you that the action of the skeletal muscle. As your skeletal muscle moves, it squeezes your veins and helps move that blood in your veins back towards your heart. Most of your arterial blood is simply pumped by the heart. So blood in the arteries is pumped by the heart contracting and squeezing and pushing that blood. But by the time it gets to your veins on its way back to the heart, it's under much lower pressure, and the squeezing of muscles helps to get that blood moving. You might remember that from the awesome classic Hemo the Magnificent. All right, so let's take a look real quickly at what happens when blood gets to your capillaries. These what we have here is called a capillary bed, and there are two types of vessels within that capillary bed. There's what's called a vascular shunt, which is this blood vessel, this vessel that connects the arteriole to the venule right here. And if this tissue is not in need of any nutrients or oxygen, or needing to get rid of waste and carbon dioxide, there's these little valves that close off the capillaries from this shunt, so the blood just goes straight through to the venule and does not go into all the capillaries here for gas exchange and nutrient exchange. However, if the surrounding tissue is in need of gas exchange or nutrient and waste exchange, then these sphincters here, these rings of muscle, will stay open, and the blood will flow through all of these true capillaries out here. Oxygen and nutrients will cross to the cells, and carbon dioxide and waste come back into the blood. So this slide here just shows you that as blood is entering, it's under higher pressure, and that's going to end up forcing out oxygen and nutrients. Then that pressure is out at the beginning of our capillary beds as they're closer to the arterioles, and then as that blood moves farther away from the arteriole, the pressure drops, and then that pressure is into those capillaries, bringing in waste and carbon dioxide. All right, something related to your blood vessels is your vital signs, right? That every time you go into the doctor's office, they're always going to check your pulse, take your blood pressure, check your temperature, and whether you know it or not, they are also checking your respiratory rate. So while they're taking your pulse, right, or while they're taking your pulse, they're going to be looking at you and counting your breaths, whether you know it or not, and calculating your respiratory rate. So what I want to do is actually take a look at your pulse and your blood pressure. This is a little different than on the slide that you have on your document. I felt like what I said before was a little too vague, but these vital signs indicate how well a patient's essential body functions are working and how well the patient is maintaining homeostasis. So your pulse is a pressure wave of blood flowing through your arteries, and it is monitored at pressure points where it's very easy to palpate or detect your pulse. That could be your wrist, right? And that's going to be checked in the radial artery. Could be done at the elbow in the brachial artery, the neck, right up here in the carotid artery, or in your facial artery, or in your temporal artery. You'll notice down here, sometimes the pulse will be taken in the foot, or down here in the ankle. And what can be done is check and see, is there a pulse here in the back of the knee, but not a pulse down here? And that could indicate, any guesses? That could indicate that there's a blood clot somewhere between where there is a pulse that is able to be detected and where there is not a pulse able to be detected. There's might be a clot preventing that blood from getting to a particular part of the body. So just something to point out there. Your blood pressure is a measurement made by health professionals on the pressure in your large arteries, okay? And when you get a blood pressure, it's usually one number over another. The top number is called your systolic pressure, and that is the pressure at the peak of ventricular contraction. And your diastolic pressure is the pressure when those ventricles relax, okay? And as your blood gets farther away from the heart, the pressure in your blood vessels does decrease. So what I do want to do is take a little closer look at systolic and diastolic pressures here at systole and diastole. So you know that your blood pressure gets taken with a blood pressure cuff. This would be something we would be doing in class. Actually, if we were in class, this would be a lab we would be doing. We would be trying to take each other's blood pressure. So what is done, the nurse will squeeze the little bulb, and that inflates this rubber cuff right here, and eventually it's going to stop the blood flow coming down the arm. So when we pump it up, right, there's going to, when they reach a point where there's no sound of the blood flowing through here that's audible, that's when they will get the systolic number, and then they release that pressure, and they'll be able to start hearing that blood start flowing. And when they don't hear any more sound and that blood is flowing smoothly through your blood vessels, that's where they get that bottom number, that diastolic number, when they take your blood pressure. So there are some factors, different factors that control your blood pressure. There are neural factors, so your nervous system will help to control your blood pressure. The autonomic nervous system is the one that's in control. Remember, the autonomic one is the one that you don't have conscious control over. The sympathetic division of your autonomic nervous system raises your blood pressure, which makes sense. If you remember, the sympathetic division is the one that is responsible for our fight or flight response. And then the parasympathetic division that's responsible for our rest and digest responses lowers your blood pressure. Your kidneys also play a role in regulating blood volume. That's what we mean when we say renal. Anytime you see renal, that refers to kidney. One thing that your kidneys do is they produce a hormone called renin that causes your blood vessels to constrict and makes you more thirsty. Those two factors are going to increase blood pressure, decrease the volume of the vessels that your blood is flowing through, and increase the amount of blood that you have. That's going to increase the pressure that your blood is providing on the walls of your arteries. Temperature also plays a role in controlling blood pressure, because heat will cause your blood vessels to dilate, which will cause your blood pressure to go down. That's vasodilation, is dilating or increasing in diameter. Cold has a vasoconstricting effect, so that causes the blood vessels to squeeze, and that would increase blood pressure. And then there's different chemicals that can cause increases or decreases in blood pressure. Caffeine can cause it to go up, alcohol can cause it to go down, and obviously your diet's high in salt and fat can also increase blood pressure. Your normal blood pressure is somewhere between 110 to 140 millimeters of mercury for your systolic pressure, and between 75 and 80 for the diastolic pressure. If you have what's called hypotension, you have low blood pressure, a low systolic pressure below 110 millimeters of mercury. And a lot of times when you are sick, that will cause your blood pressure to drop. Hypertension is when your blood pressure is too high, when your systolic pressure is over 140 millimeters of mercury. That can be dangerous if it's chronic. That puts a lot of extra stress on the heart, and leads to a higher risk of heart attack and stroke if you have hypertension for a long, long time. And that is the end of our blood vessels and blood pressure. Until next time.